Hey guys, it's Joanna. Some of you know me as saxophonist Lady Smooth Sax. Others know me as Naturally Motivated Lady from my natural hair related YouTube videos. Or you may know me as the author of the book Life Lessons in Locks. But regardless of how you're associated with me, I felt the need to share this video for a couple of reasons. First, I feel like there needs to be more awareness about autoimmune diseases. And second, because less than 2 weeks ago when I was diagnosed, seeing videos of others who are successfully fighting their autoimmune disorders was just so encouraging to me. It made me feel like I wasn't alone. And I realized that I don't owe anyone an explanation of where I've been or what's been going on in my personal life. But maybe sharing this information might help someone else. So definitely keep watching, and I'll share some details about the 2 different autoimmune diseases that I've been diagnosed with and how they're affecting me personally. So on February 22nd of 2022, I was diagnosed with lupus. Now there are different kinds of lupus. The one that I was diagnosed with is called systemic lupus erythematosus. It's also known as SLE or just lupus. And I was also diagnosed with secondary Sjogren syndrome, which is also an autoimmune disease, and would explain why my mouth is so dry right now. But I have my tea to sip on, so I'm okay. But so as not to make this video too long, today I'm going to focus on my primary diagnosis, lupus. Lupus is a chronic inflammatory autoimmune disease where your immune system, which is supposed to protect you from harmful viruses and bacteria, attacks your own healthy cells, healthy tissues, and organs. Systemic lupus can affect any part of the body, including our skin, our blood vessels, and joints, or even affect organs such as our heart, liver, brain, or kidneys. So again, lupus can attack any part of the body. It's like if you had a guard dog to protect you against all the bad guys and intruders, and then the dog turns around and attacks you. Yeah. So unfortunately, there is currently no cure for lupus, so it is a lifelong disease. It's not contagious, and actually it's unknown what causes lupus. But they suspect lupus has both genetic causes combined with environmental triggers. Lupus is significantly more common in African Americans. It also affects Hispanics and Asians more than those of European descent. And lupus affects women 9 times more often than men. But it often takes years for people to get a diagnosis because the symptoms of lupus mimic so many other conditions. And most of us who suffer from this chronic illness don't look sick. So many people, including our doctors, may not fully believe us or just overlook certain symptoms simply because we look healthy. In fact, I've likely had lupus for years, but my symptoms were always attributed to something else. For example, I would get rashes that would seemingly pop up out of nowhere or have extreme itching on my face and neck, sometimes lasting for several weeks at a time. But I was told that it was just atopic dermatitis, a type of eczema. I would get tremors in my hands where my hands would involuntarily shake, especially when I try to pick up something. But I was told that that was due to my anxiety disorder. So you get the picture. Some of my other symptoms are sensitivity to sunlight, as well as artificial light. Y'all, this is what I looked like even a year ago when I would try to help my husband in the backyard. I had to have my wide brim hat, long sleeves, nose plugs, and a mask for my allergies, and goggles to protect my dry eyes. And when I don't protect myself, I definitely pay for it later. Some of my other symptoms are tingling and sharp pains in my hands and fingers, as well as pain in both wrists and forearms. And sometimes my fingers cramp up and actually get stuck in a position. I get weird sensations in my legs. I have dry eyes and dry mouth. And recently, I've been having a lot more random pains, like lower neck, upper back pains. I'm talking about the type of pain that wakes you up out of your sleep. Oh, and the fatigue is sometimes unbearable. It's horrible when you want to do something and you're trying to do something during the day, but you have this constant tiredness and drowsiness where you just can't keep your eyes open. But a few months back in November of 2021, things got even worse. I felt like I was sick with the flu for about a month. I tested multiple times for COVID, but the tests were negative. But I had flu-like symptoms of fever, sore throat, constant fatigue, headaches, body aches, a really bad cough. Oh, and I had night sweats. And I'm talking about waking up drenched in sweat and having to change clothes. I was just feeling miserable for a good month. And I never really completely bounced back from that. And since then, some of my other symptoms became worse. But now, looking back, I believe I was also having a pretty bad lupus flare-up, but I didn't know that at the time. So as much as I hated getting the news that I have lupus and secondary Sjogren syndrome, I do feel a bit of relief in knowing what's going on with my body. And now I can take appropriate steps to do all that I can to fight it. And I want to be clear that none of these symptoms alone indicate lupus. If you're having the same or similar issues, that's something that you would want to speak with your doctor about. But my symptoms in combination with my positive blood work pointed to lupus. And maybe I'll share my full diagnosis story at some point. But during the course of me trying to figure all of this out, I saw a telehealth doctor, my primary care physician, I saw my allergy doctor, 2 different dermatologists, and an endocrinologist who thought that I was fine. There were a few things on my labs that were abnormal, and my primary care doctor didn't think much of it. So I really had to be assertive and request to see a rheumatologist. And I'm not telling you all to try and interpret your own labs, but you might want to take a look and see if something is being overlooked. So I saw a rheumatologist on February 10th, and she was absolutely amazing. She listened, she was very thorough, and she had excellent bedside manner. 15 vials of blood later, and my rheumatologist confidently diagnosed me with systemic lupus erythematosus and secondary Sjogren syndrome, just about a week and a half after seeing me. Some of my results were a positive ANA, or anti-nuclear antibodies. Also, my anti-double-stranded DNA antibodies were high, along with several other abnormal lab results that pointed to lupus and Sjogren syndrome. But despite lupus or Sjogren's, I'm going to continue to make the best out of my life. I'm still very grateful, and I still have a lot of joy in my life. And it's also been helpful to have a small circle of support. And even though some of them are battling their own serious health issues, we all love and support each other. And since lupus is a chronic illness, I'm having to learn how to adapt. I have some good days, but I also have a lot of bad days. Even doing videos is much more of a challenge now because it takes me so much longer to sort out or write down my thoughts. And on most days, the light that I need to record the videos is too much for my eyes. So I have to record during a certain time of the day in order to use partial natural light and partial artificial light. Sorry about the ring light that you can see in my glasses, I apologize. But I'm now having to redirect the reduced energy that I do have to learning how to live with not only the illness, but also the treatment for it, and work on my nutrition and things like that. But the earlier you know about your diagnosis, the sooner you can treat it. The vast majority of those who watch my natural hair YouTube videos are Black women who are most vulnerable to lupus. So I felt like I needed to share this personal part of my life in hopes that it will help someone else, or maybe encourage someone who is having symptoms to be a little more assertive and to be an advocate for themselves when they know that something is wrong, and yet their doctors or others don't recognize it. For those out there living with lupus, Sjogren syndrome, rheumatoid arthritis, MS, or any other autoimmune disorder, know that you're not alone. As much as we may not want to make drastic changes in our lives, unfortunately, our bodies may force us to do some things differently. For example, I've been getting calls left and right about doing saxophone performances. Business is booming. And as depressing as it is to turn down some pretty amazing gigs, I've had to put on pause doing live performances, at least until I get a better handle on these autoimmune diseases that affect me on a daily basis. I'm still trying to figure out the best way to live with it and manage it. So that's what's been going on with me. If you'd like to be notified when I post a video, please feel free to subscribe. I miss you guys, and I hope to talk to you all again soon. Take care. Bye.